Hey everybody, Dr. Rob here. 2019, my mantra that I want to share with you is that it's all about you. So with that being said, so many people have asked me, is there a difference between rehab and training? You know, training for performance, training to look better, just exercise and training, and rehab from an injury. How is it different and who do I see? Well, I'm going to tell you the differences, or really how close they are, and then I'm going to make some suggestions on who you see, and I'm going to give you some additions to what you're doing, whether you're training or you're rehabbing an injury. Now, just so you know, we should do a little bit of both. We should always be rehabbing so we train, and we should always be training to improve our status. So let's take a look of rehab versus training. Both consider the concept of what we call progressive overload. So when you train, let's talk about lifting weights. When you lift weights, you always want to lift a little more or add some repetition. That's progressive overload. That progressive overload allows your central nervous system first to adjust to the load. The more that we involve our central nervous system, because that's where muscle memory is, that's the better chance. That's where you can get the growth, the hypertrophy of the muscle. Progressive overload, if you want to get stronger, progressive overload can lead you to getting more muscle hypertrophy, bigger arms, bigger legs, stronger, better performance. Progressive overload is also affecting something called the sarcomeres in the muscle. You get slight tears when you get progressive overload, and your time, your recovery, what you do to get recovery, which we're going to talk about, enables you to heal and get all your goals with the progressive overload. The same thing applies, the same theme applies to rehab, because when you get a rehab injury, you want to have some progressive overload. So when somebody comes in, as long as the muscle, the tendon, and the ligaments are attached and not torn off, and you're rehabbing it, you're doing a progressive overload because you want to have fibroblastic proliferation. Fibroblastic proliferation leads to collagen deposition. Collagen deposition leads to healing and knitting of specific areas. Once again, you want specific rehab and specific nutrients and treatment modalities to be used with that progressive overload. They are the same, you just apply it a little differently. Number two, specific adaptations to impose demands. It's called SAD demands. So SAD. Essentially, the SAD principle is very interesting in that you will get used to a load and be able to get a greater load. Bones are notorious for being able to actually grow from a load. So you'll see a lot of guys in 5 or 10 years you haven't seen them, and they said, I've been doing a lot of heavy lifting, no addition of any improper additives, steroids, growth hormone, and the like. You'll see that their bones have actually grown due to the fact of that adaptation to opposed demands. The same thing occurs in rehab because you want some demands. You want to put some pressure. You want things to grow and tighten and heal stronger as they can, or stronger than they were before. Increased strength. Who doesn't want to be stronger? As we know, the number one sign of aging is sarcopenia, the loss of muscle mass. That goes back to 1998 Tufts University. There have been studies since then. So in a training program or a rehab program, you both want to improve your strength. So training, obviously, you want to get stronger. You want to get more muscle mass. You want to get more muscle performance. You want to get more muscle speed. Whereas in rehab, you want to get strength because after an injury, you're probably weak. So with that being said, you now want to be able to enable everybody to get stronger through a rehab. People come in and their arm doesn't move, or they can't walk on their leg, so you want to get strength. Strength is a great marker of performance, and when you really look at somebody, if they're strong, the age, that chronological age is thrown out. The biological age starts becoming more apparent. And as we know, chronological versus biological age are vastly different. And if we exercise, we rehab, and we train, we're then going to be able to affect that chronological age. No. Biological age? Yes. And finally, we want to increase resilience. You want to be able to, when you rehab, you want to be able to do more. Some people can only do like 3 or 4 reps of one set, and they said they're tired, their arm hurts. So when they're rehabbing, let's say their rotator cuff injury, we now want them to be able to do ample sets and increase strength and build a resiliency to be able to start to perform, because life's variations really force us to want to be able to have a specific amount of resiliency. Same thing, increased resiliency when you're training. You want more resilience. You want to be able to do more, or you want to be able to do the same in less period of time. You want to optimize what you do. So when you really look at it, they're virtually the same in concept and in theory. However, the big marker when you look is rehab is at a much lower level intensity and amount, and training is at a higher intensity and in a higher amount. Yet you're using the same themes in rehab versus training. The goals and principles of rehabilitation and training are the same. The difference is truly the starting point in which where you get it. Now, of course, one of the biggest problems when we look at here in the rehab, which is really where I specialize in, many people don't know where to start. Many people don't understand. Hopefully everybody's rehabbing from an injury. Hopefully people doing prehab not to get an injury. But if you're rehabbing, you really need to know where you start. So if it's all about you, reach out to me, tell me what you have. There's different stages of healing. There's different stages of injury. Let me help you diagnose that so you can amply get on an appropriate rehab program. Training, I can oversee if you would like. I have some great trainers at my access that I can recommend, and you can amply improve your training. They're personal trainers, to strength coaches, and the like. They will assess what's going on. We'll work in conjunction. But rehab is really what you're doing. So if you have an injury, let's ask. Now, when you look at these different ideas, progressive overload, specific adaptations to impose demands, increasing strength and resilience, what are you going to need to do? Well, let me give you a few pointers for 2019 since it's all about you. Pointer number one is you want to increase your sleep. You want to increase your sleep, number one, because when you sleep, growth hormone is released. Growth hormone is enable your muscles to recover. You want to increase your sleep because your brain actually detoxes. Not only does your brain detox and take proteins out, proteins like amyloid and tau proteins, so you're going to decrease your incidence of Alzheimer's and decrease your incidence of neurodegenerative disease. In addition to that, when you sleep, your blood pressure comes back to normal, inflammation goes down, hopefully, and blood flow increases to the outside, meaning it's increasing to your muscles, cartilage, and ligament. You get to recover. So good quality sleep is a critical element, and one of the best ways to get good quality sleep is to sleep on a good mattress. So you want a mattress, you want a memory foam mattress so you can sleep cool. In addition to that, try not to play with your phones and your blue lights right before you go to sleep. Try not to eat before you go to sleep, and if there's any way you can chill and unplug 30 minutes before you go to sleep, that's a critical element. Everybody should be getting 7 to 8 good hours of quality sleep. In addition to that, this takes care of your exercise program. Let's all get moving, 15,000 steps a day. Number three, let's pick a good diet. My two favorite diets, number one, generic Mediterranean diet, without question. A great choice. Number two, it's being talked about, it was just on Dr. Oz, the ketogenic diet. Ketogenic diet's a great diet, high in fat, great for neurodegenerative disease. The question is, with a multitude of other diets to consider, which diet is best for you? And that's, again, where I'd like to be able to come in and tell you which diet's best for you, because I will individualize it. We are now carrying so many different tests, inexpensive tests in the office to ascertain your genetic potential, you out there, that we'll be able to say which diet is best for you. Mediterranean diet, keto, paleo, 360, whole food, etc., etc., etc. So those are my suggestions. Supplements. Finally, good quality supplements. I'm always big on like 3, 4, or 5 for everybody. So let's run through a few of these. A great multivitamin, multi-mineral, omega-3. We've got some great new omega-3s. Vitamin D, some different gut protocols. So we have some probiotics, and we have something now that we're carrying, is serum bovine immunoglobulins, which are the mop of the gut. Great particular product. Love those. Just got it in a couple of months ago. I can tell you that it's changed the way I've been practicing. The fish oils, I got the fish oils now that are triglycerides for biotics, blowing the doors away, things like that. Great ideas. Let me know if you wanted me to recommend a few things like that. But for you guys out there, this year, my goal is to give you as much information. So, Steph, do we have anybody shouting out, questioning, or are we just really good? We're flowing. All right. So here we are. Every week, Tuesday, 2 o'clock, please turn in. Everybody like it, comment, share it. We've got YouTube. Don't forget about our YouTube. We put a YouTube up all the time. Our YouTube is drrobertsilverman.com. Our Instagram is Dr. Robert Silverman. Please share all the content. We are content driven. Our 2019 mantra is all about you. Dr. Rob, always yours in health.